You also said that some toothpaste like brush or scrape the what do you call it?
Emalia.
Emalia around, right?
Yeah.
Is that what's happening when you're whitening it? Like, is that toothpaste that are whitening the teeth?
No. When you have darkening of the teeth, there are two things that happens. It's either you get like layer on top of the teeth, a thin layer that gets dark, often like coffee and smoking. These things you can't brush away. It's just lying on the top of the tooth,
Right.
on the surface, thin layer. You can brush that, and it's more effective if you have toothpaste that has more sand in it. Okay, kosher sand than the other ones. But over long term, it's not good for you because you will wipe away the emalia over time. So it's getting less and less of these. But then you have the other thing, and that is the discoloration of the so-called dentine.
Okay.
That's the inner layer, inner body of the tooth. And that's usually what we want to bleach. It's called bleaching.
Mm-hmm.
And over time, this inner core of the tooth gets darkened because it will take color discoloration from the food you eat.
Okay.
Coffee, tea, red wine, chocolate, things like that. So over a period of time, your teeth will get darker. There's a difference between when you are 20 years old and 40. But it depends a little bit on your genetic, how quickly this happens and what you eat. And that's if you want to get a whiter teeth, you want to bleach. It's called bleaching.
Mm-hmm.
And there are different ways to get whiter tooth. Mostly it's used peroxide in different types, in different forms. It depends a little bit on the manufacturers and the percentage. And it's usually in a gel form. Gel.
Yeah, right. Yeah.
So you make like a small membrane around the teeth. You put the gel in, and then you put it over the teeth. And over time, this peroxide will diffuse through the emalia into the inner core of the tooth. And then it will lighten up over time.
Right.
So, and that's the usual method, the most used. But then there are different variation of that method. There's like a film. The Crest company, Proper and Gambler did. There was like a film you put on, like a sheet. That was one. It's called the Crest. And then you have the gel. And sometimes you can have things that you paint on and then you put light on. You put light on to activate. So there are these three different methods to bleach the teeth.
Right.
It's all the same mechanism. It's just a different approach.
And all of these you have to go to a dentist and like.
No, not really.
Like
Some you
can
can.
do it at home?
Yes, you can do it at home. You can buy like a Crest sheets. These thin. You just lay it on your teeth at home, or there are some of these home trays you can just warm up and you bite to them and you make them your own, custom made at home. But the best ones are those who are made at the dentistry.
Right.
When a tongue technician makes it fits nicer, it's less. It doesn't go into your mouth. It doesn't leak. It's better, to say the least.
Right. Is that the most safest as well?
Yeah.
And when you say bleaching and when you're making the teeth whiter, essentially, is that damaging the teeth in any way?
No, and yes, it doesn't damage it, but there's a theory that it can get a little bit more brittle over time, but it's very hard to prove it. But there, in very seldom cases, you get so-called eruption. where your own body starts attacking your teeth, but it's very, very seldom. But it can happen, and it's only it's less than micro percent of that, but it can happen.
Right, and what does that look like?
Then your body starts eating up your tooth, looking at your tooth as a foreign body.
Mm-hmm.
So it will destroy it in the end.
Right, so yeah.
It's very seldom, but we have seen it. It's very seldom.
Mm-hmm.
But there are some proofs that can happen, but it's so seldom that it's not really a thing that people think much about.
Right. So there's no way. So if that happens, that you just have to like remove the tooth and get a replacement.
Yeah, if you don't discover it early enough, yes, you will.
Right. So while we're on the topic of whitening the teeth, I don't know if you answered this already, but you know those whitening. We talked about those whitening toothpastes, right?
Yes.
You said that the most thing you can brush away was from coffee or chocolate, like
on the surface.
Yeah, very like on the surface of your tooth, right?
Yes.
Is that the only way the whitening toothpaste work, or
no?
there's
there's a little bit. There have been those reports I've been reading and reviews. It's so little it hardly bleeds them at all because it's so weak.
Right.
So it's more. You could more say it's because after you bleach your teeth, what happens? The day you quit, they start getting dark again over time. So after 1 to 2 years from you have bleached them, you start seeing teeth going slowly dark again. So you have to bleach again after a few years. Depends on how much coffee and how much red wine and all these things you do.
Right. You're talking about bleaching.
Bleaching, yeah.
Right.
So what happens is there are some indication that if you bleach,
mm-hmm.
and then you use some of these toothpastes that will slower that process of getting darker again.
Right.
But I remember they tried this a few years ago, these whitening toothpaste, and they didn't notice any difference at all. It was so little over 1 year period that it was more or less useless.
Right.
But it might indicate that after you've bleached, you would slow the rate going backwards again to get brown.